I'd like to welcome everyone to our electronic Board of Health meeting on October the 20th, 2021. Due to the COVID-19 pandemic, Regional Council is practicing physical distancing, and I am present in the council chambers with Councillors Galloway, Jowett, Kiefer, Shantz, and other members are participating electronically, making sure I didn't miss anybody. I would like to acknowledge the land on which we gather virtually today is the traditional territory of the Haudenosaunee, Anishinaabe, and Neutral people. We acknowledge the enduring presence of the Indigenous people with whom we share this land today, their achievements, and their contributions to our community. I would now ask the clerk to do roll call.
Thanks, Chair. Chair Redman.
Present.
Councillor Armstrong.
Present.
Councillor Clark. Councillor Erb.
Present.
Councillor Foxton.
Present.
Councillor Galloway.
Present.
Councillor Harris.
Present.
Councillor Jaworski.
Here.
Councillor Jowett.
Also here.
Councillor Kiefer.
Also here.
Councillor McGarry. Councillor Nowak.
Present.
Councillor Shantz.
Present.
Councillor Strickland. And Councillor Urbanovic.
Present.
And we have regrets from Councillor Lawrence.
Thank you, Mr. Clerk. I would now entertain a motion to reconvene in open session. If I could have a mover and a seconder. Moved by Councillor Armstrong, seconded by Councillor Foxton. Please use your voting icons to vote yes or no. That is carried, colleagues. Thank you. Before we start the meeting, I want to point out that CTS sites are not on the agenda. I won't entertain questions on them today. We will, however, receive a report from staff at our November 17th, 2021 meeting. And at that point in time, you can feel free to ask any questions. Are there any declarations of pecuniary interest under the Conflict of Interest Act? Seeing none, we have no delegations, so I would now call on Dr. Wang, Medical Officer of Health, to give us a COVID-19 update. Welcome, Dr. Wang.
Thank you, Chairman. Good evening, councillors. Kathy will project my slides. Thank you, Kathy. You could go to the first slide, Kathy. The key messages. Great, thanks. So I'll start with three key messages. One, our case rates have been stable or slowly decreasing over the last few weeks. Two, at this time, Ontario remains in step 3 of the roadmap to reopen Ontario. In addition to the proof of vaccination requirements, provincial public health and workplace safety measures are still required for indoor public settings. And 3, Ontario has developed a tool to help businesses understand the potential risks in their workplaces and customize the plan for their businesses. Next slide, please. So on this slide, the upper graph shows our case rates in blue compared to Ontario's in orange. The lower graphs show our hospitalizations in blue and ICU admissions in orange. So as you can see, these are trends that are heading in the right direction. Our case rates have been stable or slowly decreasing over the last few weeks. It has been about a year since we've experienced rates like this. Hospitalizations and outbreaks due to COVID-19 have also been stable or slowly decreasing. Next slide, please. There have been questions about what COVID measures are still required in businesses and workplaces now that vaccination rates have increased, and proof of vaccination is required in certain settings. At this time, Ontario remains in step 3 of the roadmap to reopen. In general, the following types of public health and workplace safety measures remain in effect, including for settings where proof of vaccination is required. And these include screening requirements, capacity limits, although those vary by setting and As we've heard, some settings have had their capacity limits lifted. Physical distancing and masking in lines. Wearing a mask or face covering in all indoor settings unless seated and consuming food or drink. And requirements regarding employees needing to continue to wear proper PPE. And last slide, please. So Ontario has created an online tool to help businesses create their own safety plan. The tool will help employers develop a safety plan for their workplace, understand the potential risks in the workplace, and customize the plan for their business. Safety plans must describe the measures and procedures being implemented in a business to reduce the risk of transmission in that setting. So under the Reopening Ontario Act, safety plans continue to be a requirement for all businesses and must be available for review. A copy of the plan must also be posted. And finally, we expect that the Government of Ontario will have more information to share about reopening in the coming days. Thank you. I'm happy to take any questions, or if you'd like, Chair Redman, pass it to Vicki Murray for an update on the vaccine rollout.
I see no questions, so I think I would like to welcome Vicki Murray to give us a vaccine rollout update. And then if people have questions, feel free to ask them. Welcome, Vicki.
Thank you, Chair Redman and Dr. Wang. Good evening to the members and guests of the Board of Health. I'm glad to have the opportunity to join you this evening to be able to give an update on our regional vaccine rollout. As of today at 1:30 p.m., our regional vaccine dashboard shows that the region of Waterloo has vaccinated 90.44% of eligible 12+ residents with the first dose, and 86.5% of eligible 12+ residents are fully vaccinated. As mentioned last month, our vaccine rollout continues along at a steady pace, with first dose, second dose, and now third doses being given at the 2 regional vaccine clinics, Boardwalk and Pine Bush, along with community pharmacy, primary care, the vaccine buses, and our mobile clinics. There's planning underway for children's doses as we are waiting on approval of the latest Pfizer submission to Health Canada. When children's doses are approved, they will be our priority, and we are working to ensure that we are ready to provide family-friendly ways to vaccinate the 5 to 11-year-old age group. We have already implemented processes to support those currently eligible for third doses in our community. We will be ready if more third doses are announced. Recently, we reached out to all our vaccine partners to get a sense of how they can continue to support the vaccine rollout. Preliminary data is in, and I'm pleased to say that our partners are overwhelmingly supportive and engaged. Over the past 10 months, we have gained experience and now understand which vaccine delivery modalities work best for each specific population sector. We're also using the feedback obtained from the community as part of our clinic surveys to adjust our plans accordingly. Providing vaccination for our community is a collaborative team effort. We are working with our primary care partners and our community pharmacies to understand their capacity and to be able to support their needs for any possible vaccination increases. Our vaccine teams and our partners have gotten good at ramping up during the months of the changing vaccine supply, and we intend to use these lessons learned during this planning state to be ready for any vaccine rollouts that may lay ahead of us. Efforts for our outreach continue with mobile teams and buses. I also want to encourage use of our home-based vaccine program. Anyone can go on our Waterloo Region vaccine website and fill out a form for delivery of COVID vaccine directly to their home. It is important to be able to provide an accessible option to everyone in our community. And this option has been a very successful outreach avenue for us. As always, our COVID vaccination work continues. We are still working hard to get people vaccinated. Our goal remains the same, to get as many people vaccinated as possible. Thank you to everyone for your support.
Thank you so much, Vicki, and thank you and your team for your hard work. Colleagues, are there any questions of either Dr. Wang or Vicki about the pandemic or the vaccine rollout? Councillor Galloway.
Thank you, Madam Chair. This may be too early to answer, Dr. Wang or Vicky, but I've had one person actually wonder whether or not the 2010 cohort will be vaccinatable on January the 1st. Do we know that yet? Because as the 2009s were allowed to go early in their 12th year, will that happen again, or do we know if that'll happen again? Now, of course, we're hoping that we'll have approval for 5 to 11s before then, but if that does not happen quick enough, do we know whether the 2010s will go ahead January 1st?
So interesting question. I think you've got Dr. Wang noodling. Do you want to respond, Dr. Wang?
I can start, and Vicky, please feel free to add anything. I suspect that those that are between 5 and 11, except for those that were born in 2009, will need to wait for approval of the vaccine in those age groups because the formulation of the vaccine for those 5 to 11 uses only 1/3 of the dose that is given to those 12 and up. And so I don't think Ontario would drop the eligibility down another age group because of that factor. Right now, they, as we heard on the news, Pfizer has submitted its findings to Health Canada, and Health Canada will do its usual review of the safety and efficacy. So that's another thing that we'll need to wait for as well. The sort of all clear from Health Canada that in this age group, the formulation that has been trialed, which contains 1/3 of the dose, is both safe and effective for those between the ages of 5 and 11.
Vicky, did you want to add anything to Dr. Wang's explanation?
No, not really, except for perhaps the reminder, and I think people are very aware of this, as people turn 12, they are now eligible to get vaccinated. And we have seen many people who come out to the clinic on their birthday to get their vaccine. So that will continue. And, we are waiting on Health Canada to do their due diligence and to come up with recommendations for safe vaccination of that population.
Councillor Galloway?
Well, thanks for that. The other question I had was, we're doing particularly well with the firsts at 90.44 and seconds at 86.5. And I've noticed that gap between firsts and seconds is reducing a little bit every day. So I'm just wondering what we expect the gap to be. Have the experts predicted what the gap is likely to be between firsts and seconds? That 2% of the population will not get their second? Is there any kind of a standard that people are anticipating? We're hoping that everybody who's got a first will get a second, but there may be some shrinkage. Do we know what that may be or what we can anticipate? Right now we're at about almost 4%.
Who would like to answer that? Vicky, do you want to take a shot?
I can take a shot for sure. I have not heard any percent sort of thrown out there is acceptable, except 0. And you, as you said, it is so important to get the second dose as well as the first dose. Population change every day, right? Unfortunately, we have a population as a moving target. So I don't know that truly we would ever get to 0, but we want to get as close as we can for sure. I've been watching that number as well, Councillor Galloway, and a bit surprised that it's not even narrowing faster, but I think it speaks to the number of people who are still getting first doses, which is, what we want to see happen as well. First doses will always be priority.
Thank you. Thanks, Becky.
Okay, thank you. Councillor Erb, please go ahead.
Thank you, Madam Chair. Last week, the Provincial Medical Officer of Health indicated that the rates in schools since September have been better than anticipated. And my question is, are we feeling that same confidence in the lower rates in the region of Waterloo, in the school system?
Thanks for that question, Councillor Erb. So what we've seen in Ontario, including in Waterloo region, is that the rates in schools tend to reflect the rates in the community. And so when Ontario was starting to go up at the beginning of the fourth wave, we saw more cases among school-aged children and among staff who work in schools. And we saw small numbers of outbreaks. So a minority of those individual cases would later turn out to, be part of an outbreak of 2 or 3 cases usually. So what that told us was, and we also know from our case and contact investigation that, that the large majority of those cases were acquired outside of the school setting, but because they were in children who attended school or staff who attend school, and they were in school at some point during their infectious period, we call them school cases. And so we saw that link. And similarly, what we're seeing with the rate starting to stabilize and go down in Ontario and Waterloo, the cases detected among school-aged children and staff have also been increasing, as have the number of outbreaks in schools. To date in Waterloo region, we have had low rates really of transmission in school settings. It's there's not been really any issues to date. We saw, the number of cases that I think we expected with the rates that we had in the overall community. So it's a good sign, and it follows the pattern that we have seen to date, which is that the risk in schools to a large extent mirrors the risk in the surrounding community.
Councillor Erb, do you have any further questions?
No, that's helpful. Thank you.
Thank you so much. Councillor Nowak.
I just, when you see on TV or the news that I'm just going to pull a number out that, for example, there were 500 cases of COVID in Ontario at a particular day. And then below that, it'll say maybe 300 or 450 of them were unvaccinated people.
Yes.
Does that indicate that the balance were all vaccinated and still received and still had COVID?
So those are numbers. That's a great question, Councillor Nowak. So those are just sort of unanalyzed raw numbers, so to speak, based on the daily case numbers. But then provincial expert bodies will take that provincial data and they'll make calculations to illustrate the relative risk. So how much more is someone who's unvaccinated or partially vaccinated at risk compared to someone who is vaccinated? And what we've seen with the data on Ontario to date is that if you take all those numbers together and you look at the overall trend, those that are unvaccinated are about 7 to 9 times more likely to be a case than those that are fully vaccinated. And similarly, for things like hospitalizations, those who are unvaccinated are about 25 times more likely to be hospitalized for COVID than those who are fully vaccinated. So those kinds of calculations that are put out, on a weekly or every 2-week basis by bodies like Public Health Ontario or the Ontario Science Table, really give a better reflection, I think, of what the risk is among unvaccinated versus vaccinated.
Councillor Nowak?
So those that show up as not in the, how do I put this, that were unvaccinated but have COVID, the balance are vaccinated, but they would also have had COVID in some way, to some degree.
Yes. So those numbers are really
Okay.
based on among those that are cases. So it actually only reflects the risk in us among those that have actually become cases. So they're kind of raw data, and really to better appreciate the risk, you sort of have to look at the number of cases among all those that are unvaccinated, as well as the number of cases among all those that are vaccinated, and then compare them. Because over time, as more and more people become vaccinated, you are going to find more cases among those that are vaccinated, but the number of cases goes down. And that's because of the protective effect of vaccines, even though we still see a minority of cases among those that have been vaccinated. And those cases are usually, and we see this locally with our data as well, they're much milder.
Councillor Nowak, any
thank
further
you.
questions?
Thank you. No, that's good. Thank you.
Super. Okay, I see no further questions. Thank you, Dr. Wang and Vicky. The next agenda item is the Influenza 2021/2022 plan. And this is for vaccinating, this is the annual flu shot. We're receiving this plan for information, and David Aoki is here from Public Health if there are any questions. David, did you want to make any comments, or are you just here to answer questions, or Dr. Wang?
I think David may have just a few key takeaways.
Yeah, thank you, Chair Redman and Dr. Wang. In the report, and identifies this, there are some considerations for this flu season that I would like to point out. This year is going to be very hard to predict for flu. Flu is usually a fairly predictable course, where we see cases starting around this time, slowly escalating, usually peak sometime in mid-January, depending on the year, and then slowly tailing off. Sometimes there's multiple peaks depending on the year and the strains, or if we have multiple strains active. But what makes this year difficult to predict is that last year we had no cases locally, and that nationally the cases were very low. So low that we have very little predictive information. Like we couldn't even have estimates from national bodies about the efficacy of the vaccine last year. What I will say is, still as a region, last year we distributed and had more doses administered than any year in previous, and we anticipate that to continue to increase this year, and we're continuing to really promote flu vaccine as an important measure. There has been a wide array of predictions, and I won't get into, but we hear that it's going to be a bad year because we didn't have a year last year. We've heard that there's not, it could be a year again like last year. It's hard to predict because last year we had things like lockdowns. We had, schools weren't in session, which, although it's similar to COVID, children may not get as bad as symptoms. They tend to act as very good incubators and infectious agents, spreading it amongst the community as they congregate. So we didn't have a lot of those things in place we didn't have those things, so it did mitigate the spread. This year, although there are still mitigations in place, there is reopening and there's less mitigation. So it's very hard to predict whether that's going to be, whether the mitigations are enough to keep it a small flu season, or it's going to be opened up enough that it will be able to spread. We have seen some other respiratory viruses already spread in the community, so other than COVID, so it may indicate that their flu may return. So while there's still some public health measures in place, we are really promoting the flu vaccine. And the other measure I would make is, as we have seen over the last really 5-6 years, when pharmacies have come on board, public health has taken a step back administration of vaccine, and that will continue this year for a couple reasons. First, we are dedicating a lot of our staff and resources to COVID response. Second, midway through last year, age that pharmacies could vaccinate was reduced to the 2nd birthday and above. In previous years, it had been the 5th birthday and above. So they have the ability now to vaccinate a much wider range of the population than they had in previous years. So the public health clinics that we've run since pharmacies have been onboarded are family flu clinics for those with a family member who's 5 years of age and under. This year, we have limited that to those who have a family member who is 2 years of age and under, in order to still meet that demand for people who can't be vaccinated at a pharmacy or don't have a family doctor or another place that they can get it, but understanding that family doctors and pharmacies now have a much wider range that they can immunize. Well, family doctors can do everyone 6 months in age and older, but the pharmacies are almost at that level as well. So the majority of our response for public health will be promotion and distribution of vaccines. And we have already distributed to date this year almost 50,000 doses, which is very good for this time of year. It's about equal to last year, but we expect our supply to pick up dramatically now as we enter November, which is truly when the flu season, the flu campaign for vaccination starts. So if there's any questions, I'm happy to take them. And thank you very much for the time and the opportunity to present the report.
It's a very timely information update, David, and the take-home PSA is everybody should go get their flu shot, right?
That is right, yes.
Thank you. I don't see any questions, but really a timely information, and I appreciate all of the work that public health is doing on many fronts. So on behalf of the community, thank you, and Dr. Wang, for what public health does to keep us all safe. I see no questions. It's not very often this crew is left speechless, but it appears you have left us as such. So I would now entertain a motion to adjourn. It's moved by Councillor Kiefer, seconded by Councillor McGarry. Please use your icons to vote yes or no. That is carried, colleagues, and we will resume at 7 p.m. With a council meeting. So you can turn your cameras off and don't go too far.